Welcome to our deep dive on pulmonary embolism. We know you're prepping for a situation that might involve older adults and their caregivers, and we've tailored this information to be extra useful for you. Imagine a dam suddenly breaking, sending debris downstream and blocking a vital waterway. That's kind of like what happens with a pulmonary embolism. It's a sudden blockage in the arteries of the lungs.
And it's a serious condition, one that needs to be addressed quickly, especially in older adults. We're here to give you the knowledge you need to understand what causes pulmonary embolism, recognize the warning signs, and take steps to prevent it from happening in the first place.
Okay, so let's break this down. We're talking about blocked arteries in the lungs, and usually the culprit is a blood clot, right? But how does a blood clot, which we usually associate with injuries, end up causing trouble in the lungs?
Well, you see, blood clots can form inside the body, often in the deep veins of the legs. It's a condition known as deep vein thrombosis, or DVT. If a clot breaks free from the leg vein, it can travel through the bloodstream and lodge in a smaller artery in the lungs. This blockage is what we call a pulmonary embolism.
So it's like this clot takes a dangerous road trip, wreaking havoc on the way. That sounds pretty terrifying, honestly. What kind of symptoms should caregivers be on the lookout for?
Sudden shortness of breath is a big red flag. Let's say you're helping your loved one get dressed and they suddenly gasp for air, struggling to catch their breath. That's a sign to pay attention to. Also, sharp chest pain, especially when breathing deeply or coughing. Think about it like this. The clot is obstructing blood flow in the lung, and each deep breath or cough becomes painful because the lungs can't expand properly.
So these symptoms are like the body's alarm bells going off.
Yeah.
But you mentioned earlier that diagnosing pulmonary embolism can be tricky. Why is that?
The problem is these symptoms can mimic other conditions, like heart attacks or even pneumonia. It's not always clear-cut, especially in older adults who may have underlying health issues, or they might not experience the classic symptoms as intensely. An older person with a pulmonary embolism might seem more confused or disoriented than usual, rather than showing the typical shortness of breath.
Wow, so it's almost like a medical detective case for doctors to figure out. Makes me wonder, how is pulmonary embolism diagnosed? You mentioned a D-dimer test earlier. What's that all about?
Right, so a D-dimer test measures a substance in the blood that's released when a blood clot breaks down. If someone has a pulmonary embolism, their D-dimer levels are likely to be high. That can signal to the doctor that there's a clotting issue. But it's not a foolproof test, because other things can also raise D-dimer levels. That's why doctors often combine it with imaging tests like a CT scan or a CT angiogram. These scans can actually visualize the clot itself within the lung's arteries, providing a more definitive diagnosis.
So it's like piecing together a puzzle, using both blood work and imaging to get the full picture. Now, let's talk about risk factors. What puts someone at higher risk of developing a pulmonary embolism in the first place? I'm especially interested in what our listeners who are caregivers of older adults should be aware of.
Well, age itself is a risk factor. As we get older, our blood naturally tends to clot more easily. But it's not just about age. Certain situations can significantly increase the risk, especially for older adults. Imagine your loved one has recently undergone surgery or had to stay in the hospital for a prolonged period. That immobility, combined with potential underlying health conditions, can make them more susceptible to developing blood clots.
So we're talking about a combination of age, immobility, and underlying health issues, potentially creating a perfect storm for clots to form. What kind of health conditions are we talking about here?
Things like heart disease, cancer, or even previous blood clots can increase the risk. And let's not forget hormonal changes in women, especially those using hormone therapy. It's important for caregivers to be aware of these risk factors because recognizing them early can be key to prevention.
So it's like being a detective in your loved one's life, observing their health history and current situations to anticipate potential risks. Speaking of prevention, what are some actionable steps caregivers can take to keep those they care for safe?
Well, movement is absolutely key. Even if it's just encouraging your loved one to get up and walk around the house a few times a day, or doing simple ankle pumps and leg exercises while sitting, it can make a huge difference in keeping the blood flowing. Imagine those exercises as mini workouts for the legs, helping to prevent those dangerous clots from forming.
So we're not talking about marathon runs here, just gentle movements that can make a world of difference. Are there other practical tips caregivers can implement?
Absolutely. Think about those compression stockings we discussed earlier. They're not just for long flights, they gently squeeze the legs, promoting better blood flow and preventing clots from forming. It's like giving the legs a gentle hug to keep the blood moving. Staying well hydrated is also important. You know how dehydration can make you feel sluggish? Well, it can also thicken the blood, making it more prone to clotting. Encourage your loved one to sip water throughout the day. Think of it as keeping their internal plumbing running smoothly.
Okay, so we've got movement, compression stockings, and hydration. It sounds like a lot of it boils down to staying active and keeping things flowing, both literally and figuratively. But sometimes, despite our best efforts, medical intervention is needed. What are the main treatment options for pulmonary embolism, particularly for older adults?
Well, one of the primary treatments is anticoagulants, often called blood thinners. These medications don't actually thin the blood, but rather they prevent new clots from forming and existing ones from growing larger. It's like putting a stop sign in the clotting cascade, giving the body a chance to heal.
Now, I know the term blood thinner can be a bit scary, especially for older adults and their caregivers who might be worried about bleeding risks. What would you say to someone who's hesitant about these medications?
It's completely understandable to have concerns, but it's important to remember that while there are risks associated with any medication, the benefits of preventing a potentially life-threatening pulmonary embolism often outweigh those risks. Anticoagulants are crucial in these situations, and doctors carefully consider a patient's medical history and individual needs before prescribing them. It's all about finding the right balance and having an open conversation with the doctor.
That's a good point. It's about weighing the risks and benefits and making informed decisions with the healthcare team. You mentioned that anticoagulants are a primary treatment, but are there other options? What happens in more severe cases?
You're right, sometimes more aggressive treatment is necessary. In severe cases where the clot is large and poses an immediate threat to life, doctors might use clot-busting drugs, known as thrombolytics. Think of these as the emergency responders of the clotting world. They can dissolve clots quickly, but they also carry a higher risk of bleeding, so they're reserved for very specific situations.
It sounds like a powerful tool to have in the medical toolbox, but one that needs to be used with caution. What about surgical options?
Yes, there's also a procedure called an embolectomy. It can be performed surgically or using a minimally invasive technique with a catheter. Imagine a tiny vacuum cleaner that goes in and removes the clot directly from the lungs artery. It's not always the first choice, but it can be a lifesaver in certain cases.
So there's a whole range of treatment options depending on the severity and individual circumstances. It sounds like staying informed and communicating openly with the healthcare team is crucial throughout this process. Now, you mentioned earlier that there are different types of anticoagulants. Can you tell us more about those? What are the key differences caregivers should be aware of?
Of course. Warfarin, also known by the brand name Coumadin, has been around for a long time and is very effective. However, it requires regular blood tests to monitor its effects and adjust the dosage. What's interesting about warfarin is that diet can actually affect how it works. Specifically, foods high in vitamin K, like leafy greens, can interfere with its effectiveness.
That's fascinating. Why is that? It seems counterintuitive that something as healthy as leafy greens could interfere with the medication.
Well, it all comes down to how warfarin works at a molecular level. Vitamin K is essential for the production of certain clotting factors in the blood. Warfarin essentially inhibits those clotting factors. So if someone taking warfarin eats a lot of vitamin K, it can counteract the medication's effects and make their blood clot more easily. That's why consistency in diet is key for people taking warfarin.
It's amazing how intricate the body's systems are and how even seemingly unrelated things like diet can have such a significant impact on medication. So warfarin requires careful monitoring and dietary considerations. What about those newer anticoagulants you mentioned earlier?
Yes, medications like apixaban, rivaroxaban, and dabacran are newer options that offer some advantages. They don't require as much monitoring and have fewer dietary restrictions.
That sounds potentially easier to manage, especially for busy caregivers. But are there any trade-offs? Are these newer medications always a better choice for older adults?
They can be a good option for many, but it's not always a simple decision. These newer anticoagulants might have different side effects or interactions with other medications, and they can be more expensive. The best choice really depends on the individual patient and their specific situation.
It sounds like a personalized approach is key, working closely with the doctor to weigh the pros and cons and find the best fit.
Exactly. And regardless of which anticoagulant is prescribed, following the doctor's instructions meticulously is crucial. Taking the medication at the same time each day and never missing a dose is essential for both effectiveness and safety. It's like setting a reliable clock for the body to maintain that delicate balance between preventing clots and avoiding bleeding risks.
Okay, so consistency is key. Now, aside from medications, what can individuals and caregivers do to further minimize the risk of pulmonary embolism, especially in older adults? We touched on movement and compression stockings earlier. What else should we keep in mind?
Well, maintaining a healthy weight is crucial. Excess weight puts extra strain on the cardiovascular system, which can increase the risk of blood clots. So, encouraging healthy eating habits and even gentle exercise can make a big difference. And while it might seem obvious, avoiding smoking is absolutely essential.
Right. Smoking is never a good idea, especially when it comes to cardiovascular health.
Exactly. Smoking damages blood vessels and increases the risk of clotting significantly. It's like adding fuel to the fire. Now let's shift gears for a moment and talk about a specific scenario that's particularly relevant for older adults and their caregivers. Hospital stays.
That's a great point.
Yeah.
Hospital stays, while often necessary, can come with their own set of challenges. How do hospital stays increase the risk of pulmonary embolism? And what can caregivers do to advocate for their loved ones in that setting?
Well, think about it. During a hospital stay, an older adult might be bedridden or have limited mobility due to illness or surgery. That lack of movement, combined with the stress of being in a hospital, can significantly increase their risk of developing blood clots.
So it's like all those risk factors we discussed earlier. Age, immobility, potential underlying health issues converging in the hospital environment. What can caregivers do to mitigate those risks?
The key is to be proactive and advocate for your loved one's well-being. Talk to the medical team about preventative measures like compression stockings, regular leg exercises, and even medication if deemed necessary. Don't be afraid to ask questions, voice concerns, and make sure everyone is on the same page regarding the risk of pulmonary embolism. Sometimes, in a busy hospital setting, these details can get overlooked.
It's about being an empowered advocate for your loved one's health. What about when it's time to go home? What should caregivers be aware of during the transition back home after a hospital stay?
That's another critical point. Make sure you have a clear understanding of any medications prescribed, potential side effects, and follow-up appointments. Don't be afraid to ask for clarification if anything is unclear. It's all about being informed and proactive.
Well said. It sounds like knowledge is power when it comes to navigating the complexities of pulmonary embolism, both in the hospital and at home. We've covered a lot of ground in this first part of our deep dive, from the initial shock of what a pulmonary embolism is to the nuances of diagnosis, risk factors, and various treatment options. But our exploration doesn't end here.
There's still much more to discuss. In our next part, we'll delve deeper into the specifics of those anticoagulant medications, addressing common concerns and highlighting practical tips for safe usage, especially for those caring for older adults. We'll also explore the role of lifestyle choices in managing pulmonary embolism and preventing future episodes.
So don't go anywhere. We'll be right back to continue our deep dive into pulmonary embolism. Welcome back to our deep dive into pulmonary embolism. Before the break, we were discussing the seriousness of this condition, particularly for older adults, and how crucial anticoagulants, those so-called blood thinners, are in treatment. Let's zoom in on these medications for a bit, because I know they can cause some anxiety, especially for those of you caring for older adults. You might be worried about potential bleeding risks, and rightfully so.
It's a valid concern. While these medications are highly effective in preventing clots, it's important to remember they also make it harder for the blood to clot naturally. This means easier bruising or bleeding.
So it's a balancing act then, right? Managing the risk of those dangerous clots while being mindful of the potential bleeding complications.
Exactly. That's why close monitoring and clear communication with the doctor are so important. Regular blood tests are often needed to ensure the dosage is just right, striking that crucial balance for the individual you're caring for.
Okay, so let's get into the specifics of these medications. We know there are different types of anticoagulants available. What are some of the most commonly prescribed ones, and what are the key differences you think caregivers should be aware of?
One that's been used for a long time is warfarin, also known by the brand name Coumadin. It's effective, but it requires regular blood tests to monitor its effects and make dosage adjustments.
And I remember reading in the materials that you provided that diet can affect how warfarin works. That seems a bit surprising, to be honest. Can you explain that a bit more?
Absolutely. Foods high in vitamin K, like leafy greens, can interfere with warfarin's effectiveness. So consistency in diet is essential for anyone taking this medication.
That is surprising. It seems counterintuitive that something as healthy as leafy greens could interfere with medication. Can you unpack why that is?
It has to do with how warfarin works in the body. Think of vitamin K as a key ingredient in the recipe for blood clotting. Warfarin basically throws a wrench into that recipe, making it harder for clots to form. But when someone taking warfarin eats a lot of vitamin K, it's like adding extra ingredients back into the recipe, counteracting the medication's effects.
So it's like a delicate dance between the medication, diet, and the body's natural clotting process.
Precisely. That's why regular monitoring and consistent dietary habits are crucial for those taking warfarin.
Makes a lot of sense. Now, you also mentioned newer anticoagulants earlier, like apixaban, rivaroxaban, and dabigatran. What are the advantages of these newer options?
Well, these medications often don't require as much monitoring, and they have fewer dietary restrictions, which can be a big plus for both patients and caregivers.
That sounds potentially easier to manage, especially for caregivers who are already juggling so much. But are there any downsides? I mean, are these newer medications always the better choice for older adults?
They can be a great option for many, but it's not a one-size-fits-all situation. These newer anticoagulants might have different side effects or interactions with other medications, and they can be more expensive. The best choice really depends on the individual's medical history, other medications they're taking, and their overall health.
It sounds like choosing the right anticoagulant is a team effort involving the patient, the caregiver, and the doctor working together to find the best fit.
Exactly. Open communication is key. And regardless of which anticoagulant is prescribed, following the doctor's instructions meticulously is absolutely essential. Taking the medication at the same time each day and never missing a dose is crucial for effectiveness and safety. Any slip-up can disrupt that careful balance we talked about earlier.
Right. Consistency is key when it comes to these medications. Now, let's talk about what else individuals and caregivers can do to minimize the risk of pulmonary embolism, particularly in older adults. We already touched on encouraging movement and using compression stockings. What other lifestyle modifications can make a difference?
Maintaining a healthy weight is crucial. Excess weight puts extra strain on the cardiovascular system, increasing the risk of blood clots. Encouraging healthy eating habits and even gentle exercise can make a significant difference. And as we mentioned earlier, avoiding smoking is absolutely crucial.
Right. Smoking is never a good idea, especially when we're talking about cardiovascular health. What else comes to mind?
Well, think about those everyday activities that might seem insignificant but can actually impact blood flow. For example, let's say you're on a long car ride with an older adult. Make sure to stop every hour or so and encourage them to get out and walk around a bit. Even a few minutes of movement can make a difference in preventing blood clots from forming in the legs.
That's a great reminder. It's easy to forget how much those little moments of movement throughout the day can add up. Any other practical tips for caregivers to keep in mind?
Absolutely. Pay attention to your loved one's hydration. You already know how dehydration can make you feel sluggish, but it can also thicken the blood, making it more prone to clotting. Encourage them to sip water throughout the day, especially if it's hot out or they've been more active than usual.
It sounds like staying hydrated is a simple yet powerful way to support cardiovascular health.
Exactly. And while we're on the topic of practical tips, let's talk about a specific scenario that can be a bit tricky for caregivers. Air travel.
Yes, that's a great point. Air travel, while exciting, can also pose some challenges for older adults,
Yeah.
particularly when it comes to the risk of pulmonary embolism. What advice do you have for caregivers who are planning a trip with an older loved one?
The key is to be prepared and proactive. Before the flight, talk to your loved one's doctor about any specific precautions they might need to take, especially if they're already on blood thinners. You might also want to consider compression stockings for the flight, as they can help prevent blood clots from forming in the legs.
That makes sense. Anything else caregivers can do during the flight itself to keep their loved ones safe?
Absolutely. Encourage them to get up and move around the cabin every hour or so, if possible. Even just standing up and stretching their legs can make a big difference. And make sure they stay well hydrated by drinking plenty of water throughout the flight. Avoid alcohol and caffeinated beverages, as they can dehydrate the body.
So it's like a mini exercise routine right there in the airplane aisle. Are there any specific seat recommendations for older adults to help minimize the risk of blood clots?
Yes, if possible, try to book an aisle seat for your loved one. This will make it easier for them to get up and move around without disturbing other passengers. And if they have any mobility limitations, consider requesting assistance from the airline staff. They can help with boarding, getting to the restroom, and any other needs your loved one might have.
That's a great tip. It's all about planning and communication to ensure a safe and comfortable travel experience. Now let's shift gears a bit and talk about another situation that can increase the risk of pulmonary embolism: prolonged bed rest.
That's a very important topic, especially for caregivers of older adults who might be recovering from an illness or injury. Prolonged bed rest, while sometimes necessary, can significantly increase the risk of blood clots.
So how do we balance the need for rest and recovery with the risk of blood clots? What can caregivers do to keep their loved ones safe during periods of prolonged bed rest?
First and foremost, talk to your loved one's doctor about their individual risk factors and any preventative measures they might recommend. They might suggest compression stockings or even medication to help prevent blood clots. But beyond medication, there are simple things caregivers can do to encourage circulation and reduce the risk.
Like those gentle leg exercises we talked about earlier.
Exactly. Even simple ankle pumps, knee bends, and foot circles can make a difference in keeping the blood flowing. Encourage your loved one to do these exercises several times a day, even if it's just for a few minutes at a time. It's all about incorporating movement into their daily routine, however limited that routine might be.
So we're talking about turning those moments of caregiving into opportunities for gentle movement and exercise.
Precisely. It's all about being creative and finding ways to integrate those mini workouts into their day. And while you're helping them with those exercises, take a moment to observe their legs.
Observe their legs. What should we be looking for?
Look for any signs of swelling, redness, or tenderness. These could be signs of a blood clot in the leg, known as deep vein thrombosis, which, as we discussed earlier, can lead to a pulmonary embolism. If you notice any of these signs, don't hesitate to contact their doctor right away.
So it's like becoming a detective for your loved one's health, paying attention to those subtle clues their body might be sending.
Exactly. Early detection is key. The sooner a blood clot is identified and treated, the better the outcome. And remember, you know your loved one best. If something doesn't seem right, trust your instincts and don't hesitate to seek medical advice.
That's a powerful reminder for all caregivers out there. Trust your gut and advocate for your loved one's health. We've covered a lot of ground in this segment, from the intricacies of anticoagulant medications to practical tips for preventing blood clots during air travel, prolonged bed rest, and everyday activities. But our deep dive into pulmonary embolism isn't over yet.
There's still more to explore. In our final segment, we'll delve into the emotional and psychological aspects of living with pulmonary embolism, addressing the challenges caregivers might face, and discussing valuable resources available to support both patients and their caregivers on this journey.
So stick with us as we wrap up our deep dive into pulmonary embolism. We'll be right back after a short break. Welcome back to the final part of our deep dive on pulmonary embolism. We've explored the causes, symptoms, risk factors, and treatments, diving deep into those often confusing anticoagulants. But now I think it's time to shift our focus to the long-term journey, because it's not just about the initial treatment, is it?
Absolutely not. Living with pulmonary embolism or caring for someone who is can be an ongoing process. It's a journey that extends beyond the hospital stay and into everyday life.
And it's not just about the physical aspects, but also the emotional and psychological impact this can have on both the individual and their caregivers. It can feel overwhelming, to say the least.
You're right. Imagine receiving a diagnosis like pulmonary embolism. It can be a very frightening experience. It's common to feel a wave of emotions, anxiety, fear, maybe even a sense of vulnerability. You suddenly realize that your body isn't invincible, and that can be a hard pill to swallow.
Especially for older adults who might already be facing other health challenges or a sense of fragility. I imagine it can be a real blow to their confidence and independence.
Exactly. And that's why open communication and support are so crucial. For those of you listening who are dealing with pulmonary embolism, don't bottle up your feelings. Talk to your doctor, your loved ones, or even consider reaching out to a therapist. It's important to have a safe space to process those emotions and develop coping mechanisms.
And for caregivers, remember that you're not alone in this journey. There are support groups out there, online communities where you can connect with others who understand what you're going through. Don't underestimate the power of shared experiences and finding a community that gets it.
It's important to acknowledge the emotional and mental toll that pulmonary embolism can take. Seeking support is a sign of strength, not weakness. Now, let's talk about some practical steps that can make a difference in the long-term management of this condition. We've already discussed the importance of movement, hydration, and avoiding smoking. What else can individuals and their caregivers do to stay healthy and prevent future episodes?
Those are great foundational steps, but what else can we add to the toolbox, so to speak?
Well, let's talk about weight management. Maintaining a healthy weight is incredibly important for cardiovascular health in general, and it plays a significant role in reducing the risk of blood clots.
So we're not just talking about aesthetics here. It's about reducing the strain on the entire cardiovascular system.
Exactly. Excess weight can make the heart work harder, which can increase the risk of blood clots. Encouraging healthy eating habits and incorporating regular, gentle exercise can make a big difference. And remember that conversation we had earlier about warfarin and vitamin K? Well, diet plays a crucial role in managing pulmonary embolism, especially for those on warfarin.
Right. It's like being a food detective, understanding how different foods can interact with medications and impact overall health.
Precisely. Focus on nutrient-rich foods that support cardiovascular health. Fruits, vegetables, whole grains, lean protein. And if you're caring for someone on warfarin, be mindful of those vitamin K-rich leafy greens.
It's all about finding that balance, enjoying a variety of foods while being mindful of potential interactions. Now let's talk about a specific concern that often comes up in the context of long-term management, especially for older adults: the risk of falls.
That's a crucial point. Falls can be dangerous for anyone, but they can be especially concerning for older adults, particularly those on blood thinners.
Because a fall could lead to more serious bleeding complications.
Exactly. It's not just about the fall itself, but the potential consequences. That's why taking steps to minimize fall risk is so important. And this involves thinking about both the individual and their environment.
So it's a two-pronged approach, addressing potential physical limitations and making the environment as safe as possible.
Exactly. Start by assessing the home environment. Are there any tripping hazards, like loose rugs or clutter? Is the lighting adequate? Are there grab bars in the bathroom? These might seem like small details, but they can make a big difference in preventing falls.
It's like creating a safety net within the home to minimize risks. What about those individuals who might have mobility issues or balance problems?
That's where assistive devices can be incredibly helpful. Things like walkers, canes, or even shower chairs can provide extra support and stability, reducing the risk of falls. And don't forget about regular vision checks. Sometimes something as simple as an updated eyeglass prescription can significantly improve balance and coordination.
It's amazing how interconnected all these aspects of health are. And it sounds like staying active and maintaining muscle strength can also play a role in fall prevention.
Absolutely. Regular exercise, even gentle activities like walking, tai chi, or chair yoga can improve strength, balance, and flexibility. Imagine those activities as building blocks for a stronger, more stable body, making falls less likely.
So it's a holistic approach, addressing both physical and environmental factors to create a supportive and safe environment.
Precisely. And remember, communication is key throughout this process. If you're concerned about fall risks or any other aspect of long-term management, don't hesitate to talk to your doctor or a physical therapist. They can provide personalized guidance and support, tailoring recommendations to the individual's specific needs and circumstances.
It's about teamwork, the patient, caregiver, and healthcare providers working together to create a plan that promotes well-being and peace of mind. And I think a big part of that peace of mind comes from feeling informed and empowered.
I completely agree. Knowledge is power when it comes to managing any health condition. Staying informed about pulmonary embolism, its risks and management strategies, empowers individuals and their caregivers to take control of their health and advocate for their needs.
Well said. And that brings us to the end of our deep dive into pulmonary embolism. We've covered a lot of ground today, from the initial shock of diagnosis to the intricacies of long-term care. I hope our listeners feel more equipped to navigate this complex condition, whether they're facing it personally or supporting a loved one through it.
It's been a comprehensive exploration, and I want to commend all of you for taking the time to learn more about this condition. Remember, pulmonary embolism is serious, but it's often treatable and manageable. With awareness, proactive care, and a strong support network, individuals can live full and meaningful lives.
That's a powerful message of hope and resilience. And as we wrap up, I want to leave our listeners with this thought. As medical science continues to advance, the future of pulmonary embolism detection and management holds immense potential. Imagine a world with even earlier detection, more personalized treatments, and maybe even remote monitoring to keep a watchful eye on those who are most vulnerable.
It's an exciting frontier, and it's up to all of us to stay informed, embrace innovation, and advocate for advancements that can improve lives.
Thank you for joining us on this deep dive into pulmonary embolism. We'll see you next time.